Thank you, Mr. Kennedy. Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yep. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, "I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body." So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.